Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. In this presentation, we are going to look at aortic regurgitation by 2D echocardiography and Doppler studies to determine the degree of aortic regurgitation, its effect on the left ventricular size and function, and how we determine the severity of aortic regurgitation. So let's begin with the main feature presentation. Here are some examples. You can follow with my arrow here, like a yellow arrow you can see here. Here are some examples of the 2D echo and Doppler, color Doppler studies, and also pulse Doppler. And we're going to cover each one of these aspects and show you different ways in which we can determine the degree of the aortic regurgitation, and then see what needs to be done based upon the degree of aortic regurgitation. If you start with a diagrammatic image here, like as we can see, here is the aorta, here's the left ventricle, mitral valve, right ventricle, left atrium, and here we have the aortic leaflets, and here is the aortic regurgitation. When we are talking about aortic regurgitation, that is during diastole, the blood regurgitates back into the left ventricle because of the leaky or damaged or fixed aortic leaflets. As you know, as these cusps are very, very thin, pliable, and they completely close the orifice, so there is really no blood regurgitation under normal circumstances. And here you can see there's a jet coming through during ventricular diastole. That's one of the aspects, and as we can see, by using color Doppler, we can look at how significant is the aortic regurgitation based upon the vena contracta and also PISA, which is a proximal velocity convergence, and then we can measure the jet length, which tells us the degree of aortic regurgitation. But those are all just visual observations, but we actually use calculations to determine the degree of aortic regurgitation, and pulse Doppler is extremely useful in determining the degree of aortic regurgitation, which we will be covering in the next couple of slides. As we can see, here's a pulse Doppler showing the aortic regurgitation waveform, and associated with that, they may also have some degree of aortic stenosis, and we need to determine if it's just pure aortic regurgitation or if it's a combination of aortic regurgitation with aortic stenosis, which is a more common feature in patients with significant aortic stenosis. So let's look at some of the parameters that we can measure. Number one, we can look at the width of the aortic regurgitation beam and compare that to the left ventricular outflow tract and measure the percentage. If it's like 40%, the assumption is the aortic regurgitant fraction is approximately 40% of the left ventricular output. That's one of the measures. The other one is the PISA. If the PISA is like less than 3, the aortic regurgitation is supposed to be mild, and if it's like greater than 6, it's supposed to be severe. So those are some of the things. And we also look at the pressure half time. It also tells us about how quickly there is equalization of the pressure between the left ventricle and the aorta, which is a very important number to tell us the degree of aortic regurgitation, and also whether if this aortic regurgitation is acute in nature. So let's look at some of these numbers that will help us to identify the various degrees of aortic regurgitation from mild, moderate, and severe. Like looking at the color Doppler signal, if it's faint signal, or is it dense signal, it may suggest moderate to severe aortic regurgitation. Doppler jet width, I talked about the width. If it's like greater than 40%, it is supposed to be moderate to severe aortic regurgitation. Flow convergence, small, moderate, large. And we look at the semi-quantitative, like the vena contracta. If it's less than 3, the vena contracta we saw here. So this is the vena contracta. If it's less than 3, that means it's less than 30% of the width of the left ventricular outflow tract obstruction. Then it is supposed to be mild. 3 to 6, that is 30 to 60% of the LV outflow tract, that's a moderate, greater than 6, it's severe aortic regurgitation. And of course, you measure the jet width and LVOT width. So if you look at, for example, let's go back here. If you look at the left ventricular cavity size and the depth of the jet, LV jet length, and then you can approximate, how much of the ventricle is being filled and determine whether it's mild, moderate, or severe. If it's less than 25% of the ventricular outflow tract, it's mild, between 25 to 64, it's moderate, greater than 65, it's severe aortic regurgitation. Pressure half time is a very important one. The pressure half time is measured here by taking the peak here and see when it reaches the half time. And this slope will tell us what is the pressure half time. The normal value is greater than 500 milliseconds. If it's between 200 to 500 milliseconds, it's supposed to represent moderate aortic regurgitation. In acute aortic regurgitation, it is not uncommon to see the pressure half time less than 200 milliseconds. So again, we can look at the effective regurgitant orifice, which is less than 0.1. It is mild. From 0.1 to 0.29, that is moderate, greater than 3, it is severe. Regurgitant volume. By these pulse Doppler, we can determine, using color and pulse Doppler, we can determine the amount of aortic regurgitation in terms of ml. And that will have, like here, you see aortic regurgitation 42 ml. So that's a moderate aortic regurgitation. So based upon that, if it's less than 30, the LV, ml per beat. As you know, the left ventricular outflow is approximately 70 ml per beat, heartbeat. And in aortic regurgitation, it may be much bigger. It may be like 100 to 120 ml. And if the regurgitant volume is 30, is mild. If 30 to 60, it is moderate. Greater than 60, this is all calculated by your software in your echo machine, and it will tell you the regurgitant volume, and that can also be used to determine the degree of aortic regurgitation. And the regurgitant fraction, just like the volume, the regurgitant fraction is similar to the volume, because volume is looking at the absolute volume, and the regurgitant fraction is looking at what amount of the blood is coming back to the ventricle compared to how much was pumped into the aorta during ventricular systole. So if it's between 30 to 49%, that means 50% of the stroke output is regurgitating, that is moderate. If it's greater than 50%, it is severe aortic regurgitation. Here's another table which looks at many more parameters. I've covered many of these things in the other slide. As I said, the regurgitant fraction, the regurgitant volume, and the effective EROA, or the effective regurgitant orifice area. So all these parameters, you just have to, look at these often and go through examples and determine, the degree of aortic regurgitation. As long as we have some of these main important numbers like the vena contracta and also the pressure half time. So some of the major ones, vena contracta, pressure half time, less than 200 milliseconds, which is aortic regurgitation, and the regurgitant fraction or the regurgitant volume, which all of which can be calculated by the software. So ladies and gentlemen, this is a quick overview of aortic regurgitation by echocardiography, color and pulse Doppler to determine degree of aortic regurgitation, the amount of aortic regurgitation. Then we can also, by looking at the 2D, look at the left ventricular size to see if it's a chronic aortic regurgitation and if the left ventricular function has been compromised in addition to having just aortic regurgitation. I also have written an echocardiography reference book. Here's an echocardiography reference book which I have written. You're welcome to just look through that. And if you're interested, you can buy it from Amazon.com. It's about 400 pages. It covers everything from valvular heart disease, LV function, LV structure, cardiomyopathies, infiltrative cardiomyopathies, and anything that you want to know in terms of reference values, in terms of abnormal values, and it is covered in this book. Thank you so much for watching, and I will see you in the next presentation.